Thank you very much, Dr. Vincenzo Costigliola and the European Medical Association. It is a distinct honor and pleasure to be able to talk to the Plenary Assembly and Annual Conference here today. I'd like to talk about three things. I'd like to talk about the fourth culture doctor movement and evolution. Then I'd like to talk about the Global Medical Doctor Validation Association, GMDVA. And then I'd like to talk about the emerging technology platform ecosystem that is holding all of this together. I'd like to begin talking about the fourth culture doctor. I'm sure you've been reading and seeing a lot about it recently. This is a doctor who's now, especially in this new norm and this era of digital complexity, a doctor that's part artist, part engineer, part scientist, technologist, and even part entrepreneur. This requires a new mindset as well, one of recombination and synthesis, limitless, trusting, collaborative, holistic and fluid, like-valued, and in the flow. As we all know, the community of doctors and associations is much bigger than any one organization or institution. This fourth culture doctor movement challenges doctors to be more holistic and to evolve. Doctors have always been leaders and innovators, and it's no more important than it is today in this new norm. We rely on doctors' expertise at the core to serve an aging population as well, with preventative, wellness, and well-being. I'd now like to introduce the Global Medical Doctor Validation Association. This is a validated, vetted, and trusted global alliance of not only medical doctors, but all medical professionals around the world. The vision is to be a conduit, providing a validated world database of doctors and medical professionals as a reference point to meet the needs and well-being of an aging population, and to share knowledge amongst global doctors on various therapies and treatments. The mission is to share knowledge amongst global doctors on various therapies and treatments, as well as to verify and vet that knowledge from key opinion leaders. I'd like to talk a little bit about the glue, the gel that's holding it all together. The emerging technology platform enabling this fourth culture doctor movement by providing innovation, networking, and technology. The Global Medical Doctor Validation Association is providing the framework and the standards and the validation, and the platform ecosystem is providing the technology to make it happen. This is a paradoxical journey. It's one that's bigger than the self. This is a model that's sustainable and scalable. It's a community of medical associations, and this is very important. Associations such as EMA are an integral part of our society. This platform enables associations in this alliance to provide learning and development that is tech-powered, but it's also real life experiences, and application is key. This doctor community is connected to the marketplace and to other associations in this ecosystem. we all know no one can work on their own. The world is becoming smaller. Everything is just a click away. Knowledge is being democratized. But we also all know there's a lot of misinformation and unreliable content. We sometimes don't know what's true, what's fake, what's valid, and what's not. We have virtual work, gig economy, experience economy, and an aging population. Application of the knowledge is key. We need a depth of knowledge. We need ownership of that knowledge. Otherwise, it's useless. That's why I'd like to finish by encouraging you to try it out firsthand, to access this mobile super app. It's called AMPdr, AMPdr, and you can find it in the Google Play Store and Apple App Stores. This is the platform ecosystem that is enabling the fourth culture doctor movement and evolution. I encourage you to try it out, interact for yourself, as well as to access more information about the GMDVA at gmdva.org, or send us an email at alliance@gmdva.org. Thank you very much. It's been a pleasure to be with you here today, and I trust you will enjoy the rest of the conference. Stay safe and stay well. Thank you.